Hi, I'm Amanda Estapa. First and foremost, I'm a nurse practitioner, but I'm also Vice President of Clinical Services for our company MedCentris. MedCentris is a specialty group outside of Hammond, Louisiana, where our home office is located. We service over 80 locations throughout the continuum of care, from the acute hospital to the home. So we do see patients in the acute setting, long-term acute care setting, skilled nursing facility, outpatient wound center, and actually in the patient's home. So overall, we've seen a reduction in volume in just about every location. In the acute hospital, it's a little bit difficult to navigate who's allowed into the facility to round, but for the most part, we've been able to navigate that fairly well. In the long-term acute care hospitals, our volume has increased, as you can imagine, because the acute care hospitals can't house all of the patients and transfer the care as soon as possible. Skilled nursing facilities, we've definitely seen a reduction only because in this area, especially in Louisiana, we've seen large clusters of patients positive for COVID-19. And so access to the facility has been limited. In some facilities, we're allowed to continue to round, and in those, we still continue to see our patients in person. In the outpatient center, we have seen definitely a reduction in live visits. We've converted anyone who can't come to the clinic or is afraid to venture out. We've converted those to telewound as well, so that we don't lose patients in the system. Medicaid transportation is no longer available. Medicaid is only approving transportation to certain specialty clinics, and wound medicine clinics are not included in that funding. So our Medicaid population is having a lot of difficulty getting transportation to our clinics. In our skilled nursing facilities, they're working with skeleton staff, not only because of limited access to the facility for a provider standpoint, but also the staff inside of the facilities are also being infected and isolated on mandatory quarantine. So the staffing is very limited in our skilled nursing facilities. And so therefore our patients aren't as attended to as we would like. So I completely suspect that after all of this, we'll see a huge spike in pressure-related injuries. We have pretty aggressive screenings entering any one of our locations, especially our outpatient clinics. We do have screening at the door to ask patients if they've been exposed or have any symptoms. We're taking temperatures and making sure that it's safe for everyone to enter the clinic, as well as protecting our staff. We've converted a majority of those patients in the skilled nursing facilities to what we call telewound, which is our telemedicine platform. We're working with the treatment nurse on the inside of the building to go around and use applications such as either FaceTime or Google Duo, or some way to have that communication piece with video and media so that we can access our patients and see their wounds and give directives. There are a few skilled nursing facilities that are continuing to allow us to round. And so we do have our provider and our tech, which is kind of like a medical assistant or a certified nursing assistant that goes with our provider to go into the facility and continue to round and see our patients and provide services as usual. So in skilled nursing facilities, we really love vac therapy because it reduces soiling of the wounds, therefore less frequent dressing changes as opposed to traditional dressings. We really love the fact that we have an advanced dressing that has proven benefits, and at the same time really reduces the frequency of dressing changes. For those who are able to get it, those patients with ACTIVAC, we love the ION Progress because it gives us remote monitoring capability, which, as you know, most of our problems are compliance related with these patients. So being able to remotely monitor their use and whether their unit is on, off, disconnected, et cetera, has been proven extremely beneficial. Our sales representative, David, is phenomenal. He's been extremely supportive throughout all of this and providing any assistance or offering any help that he possibly can. He works directly with our case manager at times. Our case manager loves the Ion Healing app. This gives her the ability to place orders and reorder supplies and assist the patients. We really haven't had a whole lot of challenges. I do love that 3M and KCI offer many opportunities for education. I'm also over the training of our providers, and so having the ability to access the Ion Healing app with educational videos and instructional videos is priceless, because it's not just watch one, do one, teach one, but when you have people in the field that really need that support staff or that support person and don't have a sales rep at their fingertips, it's really beneficial to be able to go online and review these videos for just a refresher and make sure that they're doing things like they should. Training in our facilities isn't as easy. We don't have everyone on site, so a lot of our training is remote. We're offering, we have in-services roughly via WebEx or Teams about 3 times a week. We're starting to taper those down now that we've kind of all transitioned a lot of our education via media. And because of Ion Healing, this has been beneficial because we have these videos to refer our clinicians and our clinical staff to. As far as, transitioning all of our patients to telewound, and now we're looking at transitioning them back. It's been interesting to see how easy it is to get patients to comply and either choose to come into a facility or be seen via telewound, or have a facility, a skilled nursing facility, agree to either allow us to come in or support us via telewound. I think it's crucial during this time that we keep tabs on all our patients, because not only are we going to see a massive influx of patients after all of this is over due to those pressure-related injuries, patients that weren't able to be seen in person, I think we're going to see an influx in patient population or volume in all settings from a wound perspective. But right now, it's crucial that we keep tabs on our current patients and prevent any wounds from deteriorating and really keep them out of the hospitals at this point. 3M and KCI offer many educational opportunities, either through kcivactherapy.com or the application of Ion Healing app. Both of these offer educational opportunities, and we utilize these in helping train our staff during this time when we're separated and can't do all these trainings in person. And as far as patient education, the My Wound Healing app is very useful for the patients to help self-educate. We can refer the patients to that application, and then they can review things in their own time. And that, of course, helps support compliance. And, we can teach the patients all day long in the clinic, but when we're using telewound or telemedicine platforms, you really have to have an educational piece to refer the patients to. So this is super helpful in keeping our patients up to date, informed, and educated. I would definitely recommend using the resources available. 3M and KCI have a multitude of resources, whether it's their sales reps in general, online applications, the websites. All of these resources are so crucial during this time to keep everyone educated, informed, and feel like they have support. The whole pandemic is a challenging time in all of our lives, especially the medical community. And we're all trying to work together and really use that camaraderie and support each other and offer resources to each other that we may not have been in tune to before.